Well, good afternoon, everybody, and welcome to the last session of the VRARA Healthcare Conference. I'm delighted that you chose to actually spend your last 15 minutes with me. I know it's getting late for some people in other areas of the world, so I appreciate you spending time with me. But why don't we go ahead and get started? So what are we going to talk about today? We're going to talk about what social isolation is and how it has a negative impact on older adults. And we'll talk about a case study on using social VR to combat those negative impacts. We'll have a little bit of a discussion about, is social VR actually helping overcome social isolation, and then what the plans are for the future. So just a little bit about myself. My name is Rob Signori. I'm a third-year software industry veteran with executive leadership experience in product management. I spent many years actually working in senior living technology. So that's technology that goes into senior living facilities. And I'm also the president and co-founder of a nonprofit organization, Thrive Pavilion, Inc. And that's what we're going to be looking at today. So sort of moving on, what is social isolation? And according to the National Institute on Aging, about 1 in 4 older adults, so those are adults that are over the age of 65, are socially isolated. And social isolation and loneliness is associated with negative health outcomes. There's higher rates of depression, there's heart disease, many other types of negative health impacts that certainly as we age, we would like to avoid. And it's been the analogies is that it could be as dangerous for your health as being a smoker or being obese and overweight or just lacking physical activity. So social isolation certainly is something that can affect all of us, but certainly in the older population, it tends to be a bit more prevalent because older adults tend to have higher risk factors for it. It could be the case that they're a caregiver for a spouse or loved one, and that's keeping them away from social activities, etc. Separation from family. Kids unfortunately grow up and move away, or your friends may move away or pass away as you get older. So your social network of people that you would hang out with basically shrinks. You may lose your mobility. It could be because of a physical condition or a disability that could be caused by a health condition, or it could be lack of transportation where you no longer have access to good transportation or can no longer drive. But really, it's limitations that happen in the physical world. We had a very hot summer here in the southern part of the United States, and I know of members that are at the Thrive Pavilion that just didn't want to go outside because it was too hot. So they kind of choose to socially isolate themselves because the physical world poses barriers. So interestingly enough, we were all part of a social isolation experiment during the COVID-19 pandemic. And just speaking from experience in working with the senior living industry, who tried to deploy Zoom calls and videos, etc., basically the current state of technology, what you would call the mobile internet. And what we found was in that industry, and I'm sure from your own personal experiences in doing things like Zoom calls, that it doesn't really create real human connection or definitely presence that can transcend location or just sort of overcome other physical limitations that we may have. As the pandemic lifts, many of us are able to go back to the life before COVID. However, many older adults are still living socially isolated. So that's where the Thrive Pavilion and social VR comes into play. So what is the Thrive Pavilion? Thrive is a nonprofit organization that we started back in April of this year. Currently, it has over 200 members, and it is growing every day. And what Thrive Pavilion provides is organized social activities, and most of those activities, although not exclusively, are done within a social VR platform called Horizon Worlds, which we'll talk a little bit more about later. Now, what's different about using or what Thrive Pavilion does versus some other VR technologies that are popular in older adult living. This is not about watching a 360 video of going down a gondola of, in the canals of Venice. Those are certainly great experiences. The difference with Thrive is what it provides is real-time events that are in computer-generated spaces. So as an older adult, you are participating as an avatar with other older adults that are also participating as avatars, and you're socializing with one another and interacting in whatever that activity may be. We have a very strong and active social media presence, both on Facebook and Instagram, and I invite you to take a look at those. So our activities at Thrive are designed around the dimensions of wellness, which are very common in the care of older adults. And quite honestly, the reason why we have done so much on the Horizon Worlds platform, it would be unrealistic for an organization like Thrive to create and develop all of the experiences that we would like to provide to our members. So we decided to work primarily in the Horizon Worlds platform, which allows us to partner with a group inside of Horizon Worlds called the Horizon Creator Community. And what they do is they help creators that want to build something. Many of them come from very diverse backgrounds, and allows that group to teach them how to build things, but also to partner with organizations such as Thrive. So you can see here over on the left is we've been able to partner with over 20 creators inside of Horizon Worlds to create or provide the experiences that we want to have for our members. Some of those activities are intellectual. So for example, we've partnered with Paige Danksinger from the Better World Museum, who I know is speaking at your summit in December, to provide museum types of experiences. We are an actual physical community. We just happen to be located inside the metaverse or inside of Horizon Worlds, and we have a creator named Farsig who changes our environment. I'm in the environment right now where he makes updates. We just had our Halloween party, so the environment constantly changes to reflect the season, the time of the year, or special events. And our community, loves to come to to our physical space and see the changes that he makes. We don't provide any sort of healthcare, obviously, at Thrive Pavilion, but we do partner with and have partnered with Dr. Linda Civarelli, who spoke earlier this morning about the work that she does at House Called VR. And we have worked with her to have seminars and talks about medical conditions that affect older adults. And certainly the most well-attended events that we have are the fun ones, the social ones. And we attend a theater every couple of months by a group called Virtual Interactive Reality Theater. Very popular game that the community likes is playing a Family Feud type game which is called MetaFeud by a guy named Simi Bro. We've partnered and collaborated with very famous or well-known creators like VidU to play bingo, or even this week when we did our Halloween party, a creator named Tanzer provided access to his world that is a costume shop. So our community was able to go into that costume shop, try on different outfits and costumes, etc., and just really had a great time. I think what's really important is, there's a lot of certainly bashing in the press of Meta or bashing of Horizon Worlds, but being a 30-year industry veteran of the software industry, if you are like me, where you're trying to build a community or you are trying to do something, a good experience quickly, Horizon Worlds has hit the nail on the head, and it is really a great and powerful platform for social VR. Absolutely. So if you are looking to do something quickly in the area of a social experience, reach out to the Horizon Creator Community, because Horizon World honestly is a great platform. So what I want to do now is just show you a couple of videos of our past activities so that you kind of get a sense of what goes on there. So the first one that we're going to look at is actually with Dr. Linda Civarelli, where we attended a medical conference where she talked about a condition that affects many older adults.
As we age to as we get older, knowing that this can happen, is there any type of exercise or something in the diet that we could do to prevent this?
Are you a plant? Did you know that this was going to be exactly the thing I was going to say? The way that you can treat this. I know. I didn't plan it. I've never met him before. Is here. The answer to the problem is stretching the Achilles tendon. That's the cure.
So that was really great. And you could see that, Dr. Civarelli was just having a great time, as was the rest of the community. So the next one I'm going to look at is with another partnership that we did with a creator called Girls Go Nowhere, who built a museum about plants. And we went and we were in part of that museum looking at some of the exhibits.
Can you throw them into the...
So this is the tropical rainforest. So we have hibiscus, elephant ear, and Venus flytrap.
Oh goodness, not back up there. How did I get up here? Get back down there, Yvonne.
Nice.
There you go.
There's also another one up there on the top.
Yeah, that one up top, it's hard. That one's hard to hit.
Watch your head.
You know the trick.
So I don't know if you could see, but in the left-hand corner there was a little Venus flytrap that was on a table, and you could stick your finger in it and have the leaves close. And this was a great interaction that so many of the community members just loved. The last one I actually going to share is from our Halloween party that we just had Tuesday here at the Thrive Pavilion. And besides going and trying on costumes, and we went on hay rides and just had a great time as a community, one of the activities that just kind of happened was a bunch of folks were standing around the courtyard here, and they decided to share stories about what it was like to trick or treat when they were younger.
We used to take pastel chalk and put it in a sock, and I lived in an apartment building, and if the person didn't answer the doorbell, we'd smack the door with the sock, and it would leave like a clock there, so you would know to avoid that apartment. Yeah.
And you couldn't just like do a little check
Leave
with
a
your
note.
like actually you had to smack it. I love that. I love that.
Yeah.
You had to smack it with the sock.
Visual.
Oh my God. It's right. I love
so
it.
Funny.
That is funny. That's awesome. I love that.
Mm-hmm. There definitely has to be a mantra now of smack it with a sock. I just love that term, and I think it'll live on at the Thrive community probably for a really long time, for sure. So what does that mean? So is social VR really helping? Is it overcoming social isolation? And I don't know. I don't have any empirical evidence. We certainly have not been around long enough to really do any studies. But what I can share with you is anecdotal evidence of what people have shared on our social media. All of these comments are completely unsolicited about either how great time that they have, what the community means to them. In particular, this one that's on the left in pink was from a new member who joined for the first time after losing a loved one who was very close to her, and was very depressed. And at least for the time that she spent at Thrive, she was laughing, and it really helped her during that time of need, at least while being at Thrive. So yes, I absolutely do think that social VR, for sure, because it makes that social connection, it has that presence, it transcends problems that people have, that absolutely social VR for sure can help older adults overcome social isolation. So what are our plans for 2023 as we move forward? We're certainly expanding our member base every day. And we do that right now. Our social media is, we're growing that. We are growing completely organically at the moment. It's either people that know other people or have family members and they tell them about what's going on at Thrive, etc. So we are growing organically right now, but we want to grow that even more. We plan on offering more activities at more times and more time zones, and really expanding the reach and how the convenience of being able to participate within the community. And there is an opportunity for sure to provide these activities in other languages, particularly in Spanish, so that Spanish-speaking older adults can also have the benefits of using social VR to overcome loneliness. Expanding in other regions of the world, we have many international members already. A lot of them are from Canada, for sure, part of North America, but we have members also that are from the UK. And when we were having our Halloween party, it was 8 o'clock here on the East Coast, but it was 1 or 2 o'clock in the UK. But they are such a part of the community and like what goes on in the community and likes to socialize with the community that they stayed up so that they could participate in in our holiday party. And we see a lot of that. So we're really expanding, again, organically, not necessarily purposefully to go to the UK, but clearly there are older adults in the rest of the world where this makes sense. So I want to thank you for spending your Friday afternoon, the last session of the VRARA Healthcare Forum. I know for me, I'm totally wiped. This conference could have been a week. There were some great speakers, some great content. It just came at me sort of rapid fire, but I appreciate your time. I do see some questions over here, so I'm going to answer them. One of the question is about AltSpace, and that's a good question. Like, why Horizon Worlds over AltSpace? There's a couple reasons. The first one is what Meta has done absolutely spot on is they have created, and it, again, in collaboration with this Horizon creator community, there's a thriving creator community, people that are building worlds. And one of the reasons that's the case is it is super simple to build worlds. That you don't need any programming or coding skills or understanding of Unity or anything like that. It is a very simple platform to build, and I give them a lot of credit for doing a lot of work to make that work. Because being in the software industry, I'm telling you, that was hard, and they really made it simple for creators. And then it makes it simple for people like me who are community builders to leverage that. And I think that's the difference, why I chose to start in Horizon Worlds rather than AltSpace. Also, AltSpace now being owned by Microsoft. Microsoft is really great at like the corporate world, Microsoft Office and Windows and things like that. And I think that the writing's on the wall, at least for AltSpace, that they are looking at it more from that standpoint as being a business platform rather than a social platform, which I think Meta gets much better. And again, there's been a lot of bashing about Meta and Horizon Worlds, but I'm not on that bandwagon. I'm on the bandwagon that they've created something just that is really brilliant and is, you can see, emotionally valuable to people, and that's really what it's all about. Let me see if there are any other questions. So we talked about AltSpace. Join us, right? If you have a MetaQuest headset, we're inside of Horizon. We've got our Facebook, our website, etc. The world is called Thrive Pavilion. Our activity calendar is published there. Our activity calendar is on Facebook, on Instagram, places like that. We'd just love for you to come once and join the community and laugh and have a good time or learn something, etc. It really is. We're very proud of the work that we're doing, and certainly very proud of our members that support us. Okay. All right. So thanks, everybody. Have a great weekend.